Welcome to the channel. Today we're taking a deep dive into antiphospholipid syndrome, also known as APS, a complex autoimmune condition that can seriously affect blood clotting and pregnancy outcomes. We'll walk through everything from how it works to how it's diagnosed and treated. Before we begin, please read our disclaimer in the video description below. This video is for educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Antiphospholipid syndrome is an autoimmune disease where the body mistakenly attacks certain proteins that help regulate blood flow. It leads to repeated blood clots in veins or arteries, pregnancy complications, and the continued presence of certain abnormal antibodies in the blood. APS may happen on its own or along with other autoimmune diseases like lupus. There's also a rare dangerous version called catastrophic APS, which causes clots in many organs all at once. It requires immediate emergency care. APS causes excessive blood clotting due to harmful antibodies that attack proteins stuck to cell surfaces. The most important protein affected is called beta-2 glycoprotein 1. It normally helps control clotting, but in APS, the body forms antibodies that interfere with its function. Other proteins that can be targeted include prothrombin, annexin-FEV, and proteins that help prevent clotting. These antibodies cause activation of cells lining the blood vessels, overactive immune cells that release clot-promoting chemicals, sticky platelets that clump together, disruption of the body's natural anti-clotting defenses, inflammation, especially in pregnancy, and traps released by white blood cells that worsen clotting and inflammation. Genetics and outside factors like infections, injuries, or certain medications can also play a role in triggering the condition. APS can affect many systems, but the two most common problems are blood clots and pregnancy issues. Blood clots may happen in deep veins, lungs, brain, kidneys, liver, and smaller vessels, which can damage organs like the skin or brain. In pregnancy, APS may cause multiple early miscarriages, stillbirths later in pregnancy, early delivery because of high blood pressure or poor blood flow to the baby, and poor growth of the baby due to a damaged placenta. Other symptoms may include low platelet count, skin changes like a lace-like pattern, heart valve problems, seizures or migraines, kidney damage, skin ulcers or blackened fingers and toes, and bleeding in the adrenal glands. Catastrophic APS is a rare and very serious form of APS that causes clots in multiple organs within days. It may be triggered by infections, surgery, or stopping blood thinners too quickly. Organs often affected include the kidneys, lungs, brain, and heart. It requires urgent care in a hospital and has a high risk of death if not treated quickly. To confirm APS, doctors look for both clinical symptoms and lab tests that are repeated at least 12 weeks apart. Symptoms include blood clots in any part of the body and pregnancy problems like loss of the baby after the first trimester, early birth because of poor blood flow or high blood pressure, and 3 or more unexplained miscarriages early in pregnancy. Lab tests include checking for abnormal clotting test results that suggest the presence of certain antibodies, medium to high levels of antibodies that attack cardiolipin, and antibodies against beta-2 glycoprotein 1. It's important to know that having these antibodies once doesn't mean you have APS. Sometimes they show up temporarily, like during an infection. Useful tests may include a complete blood count to check for low platelets, clotting tests to see if there are delays in clot formation, antibody tests done twice at least 12 weeks apart, imaging like ultrasounds or CT scans to find clots, and in pregnancy, frequent ultrasounds to monitor the baby. Treatment depends on whether the person has had clots or is pregnant. If someone has had a clot, blood thinners like heparin are used at first, then they switch to long-term use of warfarin with careful dose monitoring. If clots return, the dosage may need to be increased or aspirin added. Newer blood thinners like rivaroxaban or apixaban are not recommended for high-risk patients. If pregnant or planning to become pregnant, start low-dose aspirin, add low-dose blood thinners like enoxaparin, and if there's a history of clots, use full-dose blood thinners and aspirin. Monitor the baby closely throughout pregnancy and continue blood thinners for 6 weeks after delivery. For catastrophic APS, intensive hospital care is required. Treatment includes blood thinners, high-dose steroids, plasma exchange or immune therapy, and sometimes medications like rituximab or eculizumab if symptoms don't improve. The chance of another clot is highest in the first year after the first event. For this reason, lifelong use of blood thinners is often needed. Thanks to better treatments, pregnancy outcomes have improved a lot. Even though the antibodies may stay in the body, they don't always cause symptoms. It's important to keep an eye on overall health and watch for signs of other autoimmune conditions. Some newer treatments are showing promise. Hydroxychloroquine helps reduce inflammation and may lower clot risk. Statins improve blood vessel health. Sirolimus may help in people with kidney issues from APS. Eculizumab targets inflammation in severe cases like CAPS. Rituximab can help in tough cases where traditional treatment isn't enough. Antiphospholipid syndrome is a complex condition, but with the right approach, we can manage it effectively, whether it involves blood clots, pregnancy challenges, or more rare complications. If you found this video helpful, make sure to like, subscribe, and click the notification bell so you don't miss our next deep dive into autoimmune and vascular health. Thanks for watching.